treatment. My perforated bowel has presented numerous mental and physical challenges. Sharing my personal story has been extremely beneficial as a sort of therapy, since it has allowed me to relate to others, motivate them, and offer them hope while they are going through difficult circumstances. I am not supposed to keep my story to myself. It is meant to be shared with the world. I've overcome difficult pregnancies and delivered healthy infants at the ages of 16, 32, and 33, staying active, jumping off aircraft, climbing mountains, traveling, and generally living life to the fullest with my princesses was never an issue for me, and I always recovered swiftly. My first objective was to earn a Bachelor of Science degree in Health Information Technology from the University of Arkansas for Medical Sciences, and then return to work at the Arkansas Heart Hospital, which was my ideal job. But this time, after motherhood, it changed the path of my life forever. My infant was given home to her relatives when she was at least 6 months old. My family stayed by my side every day as I struggled for my life, and my 16-year-old sister was left to care for my younger brother, who was only a year old at the time. Come and play hopscotch with me. It's a popular vintage game that will bring back memories of hopping on successive number squares. Hopscotch seems to be there at your fingertips. The game of hopscotch transformed my life. Each square represented one problem, 2 problems, or a combination of 2 problems. This should be evident to you now. Was emotionally and physically exhausted as we went along. Nonetheless, I could see the suffering in my sister's eyes, the begging in my mother's prayers, and the cries in my father's heart, all of which pulled with me to endure. Didn't give up easy in the beginning, so I went through the motions of test after test and surgery after procedure. I overcame unthinkable adversity and am now seeing the future fulfillment of God's promises for my life. I have to admit that my surgical scars aren't quite picture perfect. Nevertheless, I am profoundly grateful, since they serve as a daily reminder of how close I came to disappearing forever. I may share with the world the new path that my wounds have shown me. God, who sent an angelic group to assist me, deserves my eternal appreciation. His CT scan 2 days after surgery, on July 22, 2019, indicated significant atelectasis, or a collapsed lung. On July 23, 2019, an abdominal X-ray revealed a large amount of fecal material in my right colon, colonic illus, intestinal obstruction, and intraperitoneal free air, all of which imply perforation. An NG2 was put into my nasal passages to facilitate gastric decompression and feeding. The NG2 procedure was extremely uncomfortable and painful. An additional NG2 was suggested, but I declined. Despite presenting symptoms of potentially lethal illnesses and disorders, I made it until July 26, 2019, exactly 6 days after surgery. My family was becoming concerned since I insisted on discussing being hot despite the fact that the atmosphere was really cool. I lay down next to the air vent, but I still didn't feel relieved. I was sweltering from the inside out. It was as if someone had lit a match inside of me, and the fire was consuming my organs and bones. My sister, who is well versed in medicine, was the only one who didn't understand. She urged that the medical professionals look into any infection symptoms. To be honest, I was on the verge of death and didn't think I'd make it through the night. My mother was fighting for me, and early in the morning, someone would check on my symptoms and indicators. However, that night, my mother was relentless, assertive, and powerful in her pursuit of help for me. The doctors performed a CT scan of the abdomen and pelvis with contrast, which revealed increased fluid and air, indicating perforation. After consultation with general surgeons, I immediately underwent emergency exploratory surgery. After opening my abdomen during the procedure, the exploratory surgeon discovered a return of free air as well as a significant amount of sucus juice, just over 3.5 liters. She noticed that there was a lot of exudate, and that my bowels were in really bad shape. The 0.5 centimeters intestinal injury sustained during the tubal ligation on July 20, 2019, was discovered during a subsequent inspection of my abdomen. She also detected several interloop abscesses. The surgeon successfully removed the abscesses and, after thoroughly cleaning my gut, searched for any remaining punctures. Given the high risk of infection, a wound vac and 2 drains were inserted into the incision. 2 drains were placed into my body, one in my small intestine and one in my pelvis, behind my enlarged uterus. I was transported to the PACU for therapeutic purposes. 3 potentially dangerous infections were discovered in my cultures: Klebsiella oxytoca, Streptococcus aeruginosus, and Enterococcus hyrae. After a few days of negligence, these infections had gotten into my bloodstream and were actively assaulting my organs. Septic shock struck me. My excrement had a toxic stink and flavor as they flowed from my mouth. On my 34th birthday, August 16, 2019, while still in the intensive care unit, I was diagnosed with acute hypoxic respiratory failure, acute renal failure, and congestive heart failure. My ejection fraction, EF, fluctuated between 10% and 15%, indicating that blood was being pushed into my heart. In addition to having terrible episodes of epistaxis, nosebleeds, I developed anemia. Due to significant bleeding, I received 2 blood transfusions on August 29, 2019 and September 3, 2019. My health continued to deteriorate. The chest X-rays revealed bilateral pulmonary infiltrates rather than edema, indicating that I had pneumonia in both lungs. I had a feeling pneumonia would be my demise. Continued to utilize BiPAP for increased oxygen while taking numerous antibiotics. With the assistance of the nurses, I eventually regained the strength to walk again, but every hour they would shift me to relieve pressure on my back and bed sores, which aided my pneumonia. My 2 lungs pneumonia symptoms subsided 3 days after treatment began. It is possible that the doctor who told me I appeared to be taking too much medication was correct. The physicians would give me anything: morphine, oxycodone, Percocet, you name it, to relieve my pain and suffering. These medications saved my life, especially when it came time to change the dressing and wound vac on my abdomen. My life was forever changed in that moment. I'll never forget the smell of flesh or the sight of being able to see deep into my abdomen. The day before discharge, August 28, 2019, was ordinary. My sister paid me a charming visit while on her way home from work. I have the best of both worlds: a caring mother and a sister who is a diligent housewife and hospice aide on her way to becoming a registered practical nurse. My sister and I had a great time laughing while watching TV and doing worship music. My excitement about returning home tomorrow was tremendous. See you later. I love you, sis. I'll pick you up in the morning. I began to miss her company soon after she left, and I quickly returned to being restless and gazing at the clock. Interestingly, it appeared that the longer I stared at the clock, the faster time passed. Following that, a swarm of medical specialists surrounded my room as if it were an emergency, which threw me completely off guard. The heart monitoring staff to me immediately. I felt alert and asked the doctor how I was doing as soon as they entered my room. Before I could answer, I went into VT cardiac arrest, which means my heart stopped beating. My soul left my physical form in a moment, and I could really feel my weight disappear. In a moment, I saw the life-saving protocols in motion and heard the code blue call for help. I was numb to pain, so the cardiopulmonary resuscitation, CPR, that broke my ribs and the 5 electrical shocks to my heart had no effect on me. Similar to Sleeping Beauty, I felt as if I were in a deep, peaceful slumber. I then realized that, while my physical body was still on the hospital bed, I was in an entirely different environment. Oh no, I just died. I didn't mean to die. A sudden sense of calm swept over me like a warm, soothing blanket, and I spoke those words in complete astonishment and dread. The reassurance that everything would be okay poured over me. The sense of superpowers came over me. Floating through a murky hallway, I felt like an immortal, drawn to a kind, welcoming light being. As if I were a feather, I flew effortlessly toward the light, feeling pure and light. Was so caught up that I couldn't take my sight away from the brightness. Radiance of brilliant light, kaleidoscope of futuristic hues, burst from the dimly lighted tube, and the space before and beyond appeared boundless. Following that, the most wonderfully created songs and calm noises echoed around the room. She held me spellbound. My sense of ease grew stronger as the light approached. Feelings of individuality, belonging, homecoming, love, and equality poured over me. A smile came over me, and I felt forgiven. I wasn't nervous, concerned, thirsty, hungry, or in any discomfort. The concept of time didn't exist. It was easy for me because I was on my way to meet God. I could briefly see and hear the stream of prayers. It's as if I handled the prayers nonchalantly. For me, it's like opening a gift and happily saying, "All of this for me." It's a solid sign that God hears my prayers. I'm not sure I knew who was praying. Every prayer felt as though it belonged to me. The prayer was beautiful. When it comes to having someone pray for you, I think more is better. Someone close to me was making a personal appeal on my behalf before God. My grandfather, whom I adored and lost greatly, was present. I believe in spirit. Finally, I arrived to a garden and was charmed by a particular flower. It stood out among the valley's other flowers, resembling a burgundy or scarlet lily. The life force and energy running through the flower's stem were visible because it was see-through. I got a glimpse of nirvana here. What came after this was a haze because the intensity of the experience was beyond my comprehension. To be honest, I don't remember being offered the option of staying or leaving. Part of me was determined to stay, but I also wanted to return to my family and infants. I couldn't turn around on my own. Being sucked back into my physical body was like passing through a portal. It seemed like time travel. There are times when I feel utterly detached from my physical shape, as if my spirit has no relationship with it at all. The elderly Shawnice died, I believe, on the day of the cardiac arrest. My sister stated that she received an urgent call to return to the hospital amid all of the chaos as she was being revived. Whatever was going on sounded dreadful, and she had just arrived home, so she had no idea what to expect. Her next action was a fast return to the hospital. My sister rushed into my room and demanded an explanation from the doctor. They mistook my sister for an employee responding to a code blue incident because of her outfit. When my sister noticed that my lifeless eyes had come out of my eye socket, she alleges that the doctor exclaimed, "What do you mean? What's going on?" She coded. She fell out from shock when she saw all of the machinery and people encircling my corpse. As soon as the doctor recognized my sister, he lifted her to her feet and ushered her out of the room. During the 20 minutes they were working tirelessly to bring me back to life. They informed my parents and held them in an adjacent private room until I was stabilized. I was put into an induced coma to ease stress on my brain and heart, but I had no idea. After being intubated for 5 days, I was eventually removed from the ventilator. Despite my slow growth, I somehow avoided becoming a vegetable. Doctors were unable to determine the extent of my brain damage because I had been unconscious for some time. The word on the street is that when my heart stopped beating and I awoke, I was stunned, but I don't remember anything. Unfortunately, detailed timelines remain unclear. Was told that I would be given medication to erase the memory of the trauma. I thank God for allowing me to retain some memories of my near-death experience so that I can cherish them and tell others about them. I was eventually cleared to return home on September 11, 2019, with a heart rate of 25 to 30% and blood rushing to my heart. My medical routine included a life